Hello, everybody. And today I am very glad to have with us Doug Parent. He is the co-founder and the COO of RingRx. RingRx provides secure, reliable, and a feature-rich communication solution for the healthcare community. They've built their platform from the ground up to offer a versatile service that meets the needs of any company, including solo providers, small and large practices, hospitals, or business associate enterprises. Doug Parent has been involved in healthcare communications for the past 22 years. He became involved in this area when he joined RingRx call center that provided custom solutions for healthcare companies. So Doug, thank you very much for being with us today.
Thank you for having me. It's a pleasure.
Yeah. So just to get started, what brought you to the point of founding RingRx? Why'd you say, hey, we need to develop something like this to provide a better solution?
That's an excellent question. I think our path was really a fascinating one, partly because I lived it myself. My story on coming to RingRx is that I was involved in call center operations for healthcare. So I dealt with doctors, clinics, hospitals, home health agencies, on delivering live agent services, mainly after hours. And we dealt with a lot of acute calls, connecting patients to doctors after hours. And for years, I realized that we were just in an environment where the obstacles that healthcare providers faced in communicating with patients was fraught with difficulties. So really, I knew that for a long time, even before I think the technology caught up. But eventually the technology did catch up, and it allowed us to build out a lot of these features that I felt healthcare needed. And so as soon as I started learning about the technology, I just started diving in to figure out how we could leverage that to deliver solutions to providers to help minimize the friction that I saw for all those years.
In the call center that you worked, the call centers that you worked with, it was probably traditional phone lines, right?
That's correct. That is correct.
So what's the difference for our viewers between voice over IP, VoIP, and traditional phone lines?
Sure. So a traditional phone line is literally just a copper wire that connects one person's phone to another person's phone anywhere around the world or the country or the city. And so that's literally a direct, hard connection. Voice over IP, which of course stands for Voice over Internet Protocol, is an internet technology. And so voice gets translated via internet protocols, which basically just another way of saying it goes over the internet. And then it de-transcribes that voice on the other end. And so instead of going over those copper wires as voice signals, it's going over network infrastructure as internet communications. And so it's different only in the sense that internet traffic is different than traditional voice copper traffic.
Yeah. And I believe there's benefits and drawbacks of both. So the internet, you're relying on all different people to support the internet. And internet traffic could slow down the internet. There could be problems, technology problems that come up with the internet. Seems like sometimes the internet phone is not allowed or accepted with certain other technology. So there seems to be some problems with that. The benefits I could think of is that it's accessible, anytime, anywhere that you have internet, it's accessible. There's a lot of configuration changes that are easily made. You can have different users. You can swap people in and out of phone numbers fairly easily. Traditional phone lines, you have the phone companies, which traditionally have been fairly reliable, but then you don't have necessarily the flexibility. So, if you're going to switch phones, you could just easily log into the app on any new phone with the voice over IP. So can you touch upon, the honest, drawbacks, glitches, but then you have the benefits. If you could touch upon that for us.
Sure, I'd be happy to. Yeah, so comparing traditional copper voice which is, I'll just refer to as a landline,
Mhm.
with voice over IP really is comparing, bedrock, foundational, predictable, reliable service with kind of the Wild West.
Mhm.
And so voice over IP being the Wild West. And so really, the big upshot of voice over IP is that we can blend all kinds of new features that are available on the internet that were not available to traditional landline services. And so we do a lot of this at RingRx. We build a lot of additional features that are not just voice related that play a role in communications. And so being on the internet, it opens up a huge opportunity for flexibility, versatility, data management, security. I'll touch on security briefly insofar as these two technologies compare, is that technology of traditional landline, there's nothing wrong with it. It's perfectly fine.
Mhm.
But there are virtually no features that back that up. In order to have a secure, say, communication solution on a landline service, you'd have to buy your own phone system to sit in your office and crunch phone calls all day. And
Mhm.
really, it's only limited to phone calls. With voice over IP, it gives us a huge opportunity to not only know what data is coming in, but using that data as far as providing services, but also securing it. So we know what kind of security measures we're adding to our service so that it benefits our customer. So there's a huge amount of options when it comes to internet services as opposed to traditional landline. And so really the quality and the capabilities of the service itself come down to the people who are managing it and building the product. And so that's where we come in. And of course, that's how we design and make our decisions about building our product.
Uh-huh. Yep. And then the way that it operates on the phone. Um, we
Sure.
could use, yep, I'll let you
Yeah.
just speak to that.
So traditional landline services, you basically get a couple. It's called a twisted pair. So you get a pair of copper wires that plug into your wall. You
Mhm.
plug your phone into that, and you get reliable, predictable service. With internet, just like with voice over IP, just like with anything on the internet, there are a lot of variables that come into play on this. And so any phone, whether it's a mobile app, which we do a lot of service with our mobile app, which we'll touch on in a few minutes,
Mhm.
or it's a more what you think of as a conventional desk phone. Both of those, um, what we call endpoints or access points,
Yep.
have to be able to decipher internet technologies and communication protocols properly in order to give the right kind of voice quality that you would experience from traditional landline.
Mhm.
In the early days of internet and the early days of voice over IP, that was not very good. There were a lot of pitfalls to that. And so, people thinking back maybe even 6 or 10 years ago with internet phones back then,
Right.
people had a very mixed experience and frequently a bad experience.
Right. Yes.
We don't have to mix words on this. It
Yeah.
had very early
I've
problems.
experienced that.
Yeah, but now bandwidth is so fantastic in the United States and around the world that a lot of those problems have been smoothed over. Speed does not solve every problem, but it does alleviate most problems. And so now most people's experience would be excellent right out of the box.
Yeah. And some voice over IP systems are able to use the cellular service or data or Wi-Fi. Is that right?
So some do. We are exclusively data. So if you're using our service, you're either going to be using a Wi-Fi connection or cellular data.
Okay.
And we chose to go that way exclusively for security purposes, obviously in our industry. There is a way to hand off a call to a cell phone's voice side of a cell phone as opposed to cell phone data, but you lose a lot of the security control over that. So we do not do that currently. There's an option to do it, but it's only done at the discretion of the customer. So
Okay.
and I'm sorry, I backed up on that a little bit because it's not that common for us. We only do it in very specialized circumstances, but typically with us, you're either going to be talking on a Wi-Fi connection using data or your cellular data connection, not cellular voice.
Okay. Yeah. So and it like doesn't get forwarded to their say cellular service line.
Bingo. And that's
Right?
the main thing is that we, as part of our service, we want to keep the call on our platform the whole time, even as it goes to our customer's voicemail box, so that we can encrypt that voicemail message. If we hand it off to your cell phone and it goes to the cell phone's voicemail, we lost control of that.
Sure. Yeah. Now, people do experience some glitches with voice over IP using their mobile phone. Missed calls, not seeing the call, stuff like that. Have you hear of that? What's that about?
We do hear about that, yes, and it's a significant issue. We work with our clients on all facets of troubleshooting and optimizing their service. And so just to kind of, stab this directly, the issue is something called quality of service. And what that means is on calls or really any internet traffic that comes into a location, let's say it's somebody's office, it comes in, until it's managed, that data just comes in just like a freeway. It's going to have cars just kind of driving down that freeway, changing lanes, getting on, getting off, and then there's really no management of those. If you imagine each car is like a packet of data, whether it's voice data or somebody downloading something or somebody watching video or anything like that, or just browsing the web, all those cars represent different packets of data coming in. If those packets of data are not managed, they'll bounce into each other, and the end result could either be calls that you can't answer or difficult audio quality or all kinds of different problems. So we work with our clients to make sure that their route, and so the correction for this kind of a solution lies within a router, and it's a quality of service adjustment. We usually guide our customers to go into their router, make a setting change, and then that usually fixes any kind of an audio quality or being able to receive a call issue.
Yeah. And then there's other configuration changes that people can make on your platform for security purposes.
Sure. So in general, all of our services come out of the box as totally secure. Any piece of data is already encrypted if it's within our system. That would be, of course, voice calls, that would voice messages, that would be faxes, that would be text messages. We'll touch on text messaging because there's kind of a special characteristic of them in a moment. But everything right out of the box, if they plug and play, it's all secure. Now, there are some features that we offer. Oh, and I'll also mention transcription of voice messages. That's also included in there. And that also includes automatic call recording, which is a feature that we offer as well. So it records the call bidirectionally, and that will also be secured. There are a few features, to clarify, that can be set that technically are not HIPAA compliant. We guide our clients on this. It is not activated by default. It can only be activated by override and intentional setting by the customers. And those would be voicemail to email, and those are, and that's also texting outside of the service to, say, a patient or somebody who's not on RingRx. Texting between customers is totally secure, but once anything leaves our system, it's not something that we can control anymore. I'll dive into texting maybe in a bit more detail later, because there's so much dedicated to texting these days.
It's good to hear that you guys really think about these things, because I can't tell you the amount of companies that I've contacted asking them to have the default as notifications turned off.
Right.
And then the individual user can make the autonomous and informed decision whether or not they're going to turn those notifications on.
Exactly.
But man, I tell you, historically, people would have those default as on because people like the convenience of it, but it's a security issue. Now, when notifications are sent to someone's email, does your email service utilize TLS encryption?
So we do use TLS encryption, but to clarify, so we offer two options on emailing notifications. One is just simply a notification letting you know you have a new message. This is and we're talking only email notifications now. Another is an email notification that actually includes the WAV file of the message. Okay, so the notification is sent without an attached message. That is totally secure. There's no violation of that. Okay. When we're sending the WAV file, which is the voice message attachment, for the most part, we say that is not HIPAA compliant. Now, but mainly what we're saying is it's up to the customer to decide if that's right for them. But we're no longer claiming that we're securing for that for them, if that makes sense.
Yep, that makes sense. Yeah.
And
Excellent.
really, the issue, maybe to clarify a little bit about email, the issue with email is that we can send it out secured and you can receive it secured, but there are so many intermediating stages between us and the recipient that we don't know what their security measures are. So if it goes through other email servers or services, we just don't know. So that's just something we can't assure HIPAA security on.
Yeah. But if the user had a BAA HIPAA-friendly email service that does utilize TLS encryption for encryption in transit, and you're using TLS encryption, it ought to be encrypted in transit, and then of course secure at their email provider if they have it set up that way. But yeah, that would be for them to really
correct
analyze that risk before turning that kind of feature on. Yeah,
exactly.
Yeah. So texting. Texting is highly utilized. SMS, MMS texting cannot be encrypted. The FCC, Federal Communication Commission, not recategorized it, so now it's even less secure because phone companies can look at that data, they can modify that data, they can block that data. But I know that RingRx offers texting. They have texting within their environment, which is secure for the workforce to communicate with each other, and it does have the capability to text outside the RingRx environment, which would obviously create texting issues. And then I'll let you speak to that, and then I have another question for you on that.
Sure. So we offer SMS texting and also texting within our platform between users. And so to clarify just about our feature, as it is that if you text between coworkers or other customers that are on RingRx, it's totally secure because all those messages only reside within our system, so we're able to validate that it's secure in transit and in storage at rest. Once you text, I should back up. We also offer the ability to text 10-digit cell phone numbers or 10-digit landlines that have texting. Those text messages will leave our service. And once they leave our service, we're not able to secure those any longer. And so that, while we do offer the service, we offer it because we recognize that our customers are, of course, they're healthcare customers, but they are companies. And nowadays, companies have to be prepared to engage in texting. Whether it's right for that company or not, it's their decision. We offer it, and we offer it with the guidance that it needs to be done judiciously. For sure, we advise them to develop their own practices on using this. They should not send PHI outside of the service using RingRx to a patient. There's no reason they can't communicate with a patient as long as there's no PHI exchange. It's perfectly legitimate. You can talk about appointments, giving directions to the office, any other business matters, but no PHI, no diagnostics, no prescription advice, nothing medical in any way. Other than that, for business purposes, it's completely fine.
Yeah, and when it's sent outside of RingRx, it is unable to be encrypted in transit, correct?
That is correct. And that is exclusively a function of the SMS technology. As you mentioned a moment ago, SMS is just simply a technology that doesn't have a lot of advanced capabilities to it. It is a simple message service, and so it literally cannot be secured.
And the other question I have, does RingRx have any plans on offering the ability for patients to be able to get a profile, to be able to do secure texting with the providers? Because there's companies out there that do this, right?
Right.
And it's very helpful. It's maybe not utilized as much as one would hope, because the patients aren't going to want to have to download an additional app just to communicate with their provider.
Right.
However, it is a really nice tool to be, to have.
Sure.
Any thoughts on that?
Yeah, that actually is on our roadmap. We do expect to have something this upcoming year in 2020. And
Mhm.
so it would be a messaging capability built into our portal. And so it would either be able to be sent through the mobile app or through our portal, but then it would send effectively a link for the patient to be able to log in. They'd probably have to create their own profile, but then they would log in, they'd be able to message any
Yeah.
provider that they have.
Yeah. So they wouldn't, they wouldn't get a RingRx number,
Exactly.
but they'd be able to communicate. That, I highly recommend that,
Mm-hmm.
because that's one thing that it seems like technology-wise you could add on,
Mm-hmm.
and people are really looking for that, full
Right.
package kind
Right.
of deal.
Thank you.
So there's other providers of, internet phone that don't provide some of the things that you provide, like faxing.
Right.
So you provide the secure eFax, which is really, really helpful for our customers.
Mm-hmm.
Yeah, and another feature is that with RingRx, providers could have full control over their workforce, so they can assign numbers, reassign numbers. They have full access to all the voicemails and data that goes through. They can cut someone, an employee off from access
Mm-hmm.
to that number in the voicemail.
Mm-hmm.
The data is stored on RingRx. Yeah, and can they set it so that clinicians are not able to delete data? Can the admin make it so that data is not deletable?
Sure. So actually, voice messages are deletable by the user itself. If there's of course, there's an admin in every office, so any admin can modify user access at any time. They can log right into the portal. They can change access. But yeah, so users can delete messages. They cannot delete call data. So any call data is exclusive access of admin. And then any recorded audio of users is also not anything that they could delete themselves.
Okay. Yeah. One recommendation I would have is for admin to be able to turn off the capability of other users to be able to delete data.
Delete a message.
Yeah, especially when you guys launch the texting with patients. If admin
Sure.
turn off that capability,
Excellent
just
suggestion.
for risk. Yeah.
Sure.
And then, do you guys happen to offer any like templates or suggestions for a user guides for clinicians, or policies and procedures for using the technology? Any like templates? If not, that's fine. That's what.
Sure. So I wouldn't call it a template. We have a variety of guides and white papers that actually, I wouldn't say it would cover them 100%, but it does give a lot of insights as to technology aspects of communicating with patients. We probably have, I don't know, 5 or 6 different white papers that would in total cover a pretty good amount of either a therapist's practice or even a larger medical office that we serve as well.
Okay.
Yeah, and then of course we have our own support pages that give a lot of information and guidance on how to configure things. Part of our challenge is, well, I shouldn't say it's too much. Part of our challenge in delivering something as focused as that is that our platform is extremely versatile. It can do, it's really an enterprise class phone and communication platform. So the configuration capabilities are, as endless as you can imagine from any.
Right. Yeah. Like I'll mention some that I like you have,
yes.
office hours, or like on and off hours,
Right.
on call person. Right.
Right.
Yeah. So those things are very, very helpful.
Right. So on focus things like that, we do have quite an extensive guide library on things like that. And so, for sure, where we deviate from any generalist competitor out there, we have a pretty good amount of support and guidance documentation.
Yeah. Okay. Yeah, that'd be very helpful. And then is the admin able to audit the access logs?
Yes.
And does your system have, say, automated alerts of any unusual activity?
Yep. So on the access logs, the admin can log in and right in our setting. We make it really easy. If I can back up a little bit, our philosophy is to take the take the effort out of compliance, right? So
Yeah.
we have built this to make compliance as painless as possible. I myself don't really like compliance. I think, it's aggravating to have to go through that from a business person standpoint. And so we built it out to make it as easy as possible. So an admin, if you're ever audited, if you ever need to see who's attempting to make access, maybe you have a terminated employee or even are worried about a security threat, you can log right in, go to settings, and literally it's one click. You can see who's trying to access your account in general. We also provide access logs to individual messages, so you can see who has played or tried to access what message. And that is very important from a HIPAA standpoint because it goes to what's called custodianship. So custody of PHI is critical to know who has tried to access it and whether they have had the right authority to access something. So we make it very clear to that. What I will say is we don't have automated notifications. That's actually a great suggestion. So that would actually be something very easy to build into our access logs to, Bing, send a notification email out to a customer. So I don't recollect that we have that right now, but that is probably on our, building plan. I just am not totally aware of where we're at on it, but it would be an easy one to add.
Yeah. So for HIPAA compliance, covered entities have to have a policy and procedure on auditing their access logs, and they need to actually do it and follow their policy and procedure. Right. But it's such a hassle for people. A lot of times they don't do it. So having the automated alerts just makes it way easier for them to see if anything fishy is going on. Yeah. So what would be the how does RingRx kind of rise above some of the competitors and in other ways not provide some things that other providers of this kind of service provide?
Sure. So I think stepping back, as I kind of touched on just a minute ago, is that we're really an enterprise class communication platform. So if comparing us to some other competitors out there, whether they're generalists that maybe offer an app on the App Store, or maybe even it's a better developed app that has some healthcare specifics to it, we of course do offer our services as an app. Our app is fully integrated to our communication system as any other part of our system is, whether it's our user portal or a desk phone. We look at all of our endpoints as being equally important to our customers. So I think that, if you're comparing us to a company that is really focused on an app, we are focused on an app and everything else. So you have the entire enterprise solution that forms the foundation of our service. And the reason I mention that is if it really is just an app service that you're comparing us to, inevitably you're going to come across a time where you're going to want a feature or your system to be able to do something it's just not going to be able to do.
Can you give maybe two examples of that?
Sure. So our two that kind of stand out a lot that we solve a lot of problems with are our menu, our what's called an auto attendant in the industry. Really, there's like 20 names for an auto attendant, but suffice it to say, it's like a phone tree or a menu or an IVR. Sure. And then another, what we call a ring group, and I'll get into ring groups a little bit in a moment. But
like the ring groups.
Yep, our IVR is so powerful. I mean, it can do amazing things. We really, we learn new things about it almost every day on how we can use it to, not that we are understanding what its features are, we know the features very well, but how we can solve problems. I mean, that's really what we try, we are oriented to help our customers solve their problems. And so the menu, the auto attendant, it really comes into a huge play there. It's very versatile. We have a lot of ways of configuring it, multi-locational, regional, geographic, and most providers and even smaller healthcare companies, they don't need all the power of it, but we find all the time that frequently, even smaller companies, they need one little thing that typically is such an advanced feature that it won't be available in a lot of different services. Ring groups, they are we love, in our office, we love working with ring groups. It's kind of like our funnest feature,
Right.
not because, it is kind of boring, right?
Accurate.
Right, exactly. You ring more than one device at a time or in sequence, right?
Yeah.
So, but ours is great because it has so many layers of the feature. So for example, let's say you have a medical appointment department and you have, you have an appointment department and you have a medical records department. This might be in a bigger, doctor office.
Yeah.
We can set, there's a parameter within our ring group that a call can come in, and it can even go to the same 3 people, right, that are sharing duties in an appointment, capacity and a medical records capacity. When the call comes in, we can put a little note on the call itself before we even answer it that says, this is a medical appointment call, or this is a medical record call, or this is an appointment call. So the people going to answer the phone know why that person is calling in.
Right.
It's not a huge thing. It's easy for us to do. But on the customer side, it's a big difference in the workflow because
certainly,
there might be 2 people that are mainly going to be doing appointments, and the other person is just kind of helping out. That person's going to let the other 2 grab that call first. And so things like that make a big difference in how you actually work in the office. And we find that it really alleviates a lot of friction just in, basic workflows in an office.
That makes sense. One thing that I have struggled with is, so a phone number of a patient connected to healthcare service is PHI, right? So just having a patient's contact information as their healthcare provider is PHI in of itself. So having a contact list in the app that is quarantined to RingRx's environment would be extremely helpful, because you don't want to use you don't want to use your phone's contact list that might be synced with either a Google account or Apple account that may not be covered by a business associate agreement. So I spoke to RingRx a while back, and I think they said they were thinking about in the future.
We actually have that now. Yeah, so that's a feature.
You said, did I hear that right?
Yeah. So earlier when I said we're not the best company in terms of boasting and marketing and even just telling our customers when we have a new feature, that is something that we've added. So you can go.
Nice.
So it's a little limited at this point. You have to go into the portal and add your contacts there.
Okay.
You can import them as a spreadsheet, so you can pull them right in if you have a bunch, whether it's on G Suite or in your phone or just in any kind of EMR or something like that.
Yeah.
You can export them. You can pull them right in, and then within the app itself, you can go into contacts, and then you can toggle whether you want to give access. Your cell phone contacts access to RingRx app, and you would decline that.
Right.
But you can toggle between the 2. So there's a tab for RingRx contacts. So when you're in the app, you will see them in there. And if you use desk phones, they automatically populate on your desk phone as well.
Perfect. Nice. I like it. Thank you. Appreciate that one. Big time.
That was a big one.
That's been a thorn in my side.
That was a big one. Yeah.
So do you guys do any integrations with, say, EMRs, EHRs, practice management programs, people?
So EMRs are, the cornerstone of integrations for us. And, I forget the exact number now, but I think it was around 2015 or 2016 when the number of EMRs in the market hit their maximum, and it was like 895 or something like that. But there were almost 900, just under 1,000 registered EMRs in the United States. They've consolidated quite a bit since then. But the only reason I mention that is, and there are a lot of EMRs. We'd love to integrate with all of them. We've integrated with a handful now. Integration is very good. It's very powerful. It's a wonderful thing. It's probably going to be our number 1 product roadmap for 2020. It's picking as many, high value, high use EMRs that we can integrate with.
Well, if there's an EMR that wants to integrate with RingRx, can they pay a fee to have you guys work on that integration, or how does that work?
Sure. Yeah. So actually, normally not a lot of fees are exchanged when it's company to company. So backing up a little bit on integration, integration occurs through what's called an API, which is a technical ability for unrelated applications to handshake with each other.
Mhm.
And so we have a very robust API. It's very public. It's accessible in our support documentation.
Yeah.
And anybody can use the API to build their own applications or integrate to their own EMR, whatever they'd like to use it for. So normally the way it works with an EMR company is we would usually start with a customer request. So our customer would say, hey, I use this EMR. We'd love for you to integrate. We'd say, that's great. Introduce us to your EMR. Let's get a contact there. And then once we had a contact, then we would work with them directly on building an integration. Yep.
Mm-hmm.
So we have done that in many cases. And some EMR, some companies, whether it's an EMR or a practice management company, their desire and ability and availability to actually provide the resources that we would need to be able to integrate with their product, it's all over the map. Some are great, some are very open, they're very responsive, they want to do it, they see this as bringing value to their customers. And then, of course, on the other side, the exact opposite, where you can never get a hold of anybody, they don't want to devote resources to it, they look at their product as being, the 800-pound gorilla, and they don't want anybody even touching their product. And so, unfortunately, that's kind of the nature of the industry. But a lot of minds are changing, and we are in the philosophy of open is everything. And so we want to be as open as possible. We want to share with as many companies as we can. And so we're very open, and we're willing to put the resources in.
Has it worked well? And has it been utilized?
Yes, it has been utilized. It works well. There are a couple of features that we want to push on EMR integrations, which means we would like to see it get more accepted and more desired from our customer standpoint. The main one being click to call, meaning you go into your EMR, you find a patient, their phone number is there. Our code makes that phone number dialable. You click on it, and it calls out through our system. Mm-hmm. So that we're prepared to do. We've had a couple small companies that have integrated that, and it works great. Yeah. Another one that for sure the most common integration is just faxing. So that fax is coming to us, and then it dumps into the EMR with some metadata on there, so that they can save it to the right patient file really easily.
Oh, okay.
That works fantastically. The other one that we let's see, what was I going to dive into on the other integration? Well,
I have a question about the click to call, because on the dashboard online you can't make a call, right? You have to use a smartphone or a.
Exactly. So we're actually building our own. It's an application that runs in the browser that you'd be able to make calls from, and all your contacts would load in there, and all your call history would load in there, so you'll be able to call out of there. We just never built a phone for the portal yet.
Okay.
But that was a 2019 roadmap, and we're pretty much almost done with that. So that should be out. It may not be done by the end of the year, but it should be early 2020 if not.
Oh, that's great.
We're beta using it right now, so it's toward the end of its development life.
That's great.
Yeah.
Yeah. Well, Doug, thank you so much. This has been extremely informative for people.
Thank you. It's been a pleasure talking with you.
Yeah, I'm sure of it. So, so hopefully you all could visit RingRx. Here's their website, and their contact information will certainly be below. They have great pricing. And so I personally use RingRx for my private practice, and I've been doing so for, a few years maybe now. And my experience has been good. The thing that I've really liked about RingRx mostly is the customer service has been fantastic. So when you call RingRx, you don't get like a voicemail or sit on the phone forever and not get anybody. I get somebody, and they're able to help me. And then they follow up with me through email. If there's something that they don't know that's more technical, they send it over to the tech team. They get right back to me. So Doug, your customer service is fantastic.
Well,
it's funny that you're the co-founder and you worked in customer service.
Yeah.
Right? So, yeah, you guys have that down.
Thank you.
Yeah. Well, thanks a lot, Doug. I appreciate it.
I thank you very much. I appreciate your time, and great luck to you, and thanks for having me on today.
Yep. Excellent.